Like in order for it to push, or as a
I thought this was a family program.
We are really ambitious. Even manufacturing this was years of work. We went through over 100,000 iterations of this to be able to get one that could fit your mouth, that could fit my mouth, right?
I had a bad dentist, French dentist, who taught me Americans were too obsessed with flossing. The next hygienist I went to was like, your teeth look awful. And he's like, are you flossing? And then I was like, no. And then I told him the story. He's like, that guy's a fucking liar.
So when we were looking at demand, one of the things we did was on Amazon, we said, okay, well, let's look at all these. Some of these devices were selling 30,000 units a month.
Oh my goodness.
2 and 3 stars.
Like what? Do you have a supplement routine?
Yeah, I got about 50 plus supplements.
Okay.
Man.
Gentlemen, welcome today. Kenny, Hamet, thank you for being here. I'd like to start us off with our opening ceremony and ask you our initial line of questioning. This is the first time we've had 2 guests, so I'm going to have to ask this question twice, but hopefully you'll both have your own unique answers. Hamet, I'll start with you. Can you tell us about your first job, your worst job, and your current job?
My first job was cutting grass.
Nice.
As an entrepreneur. And that was when I was 12. My worst job was a job after that at Hot Shops. I was a busboy.
Okay.
And that wasn't fun. I didn't do that long because I didn't enjoy it.
Yep.
And my current job is as CEO and founder of Share Ventures. We are a venture lab and fund focused on human performance and AI.
Awesome.
Yeah, my first job was at Home Depot. Enjoyed the building process.
Yeah.
And so I got a job at Home Depot. My worst job was probably at a restaurant as a server. Just it's just
Say no
just
more.
different cultures.
Understood.
Yeah. And then my current job is somewhat dual in nature. I'm actually an oral surgeon, but also co-founder and CEO of Feno, which is an oral health tech company.
Awesome. And what is your relationship to a venture lab?
Yes. So I actually started as a physician / entrepreneur in residence at Share Ventures, thinking about ideas, thinking about problems, which we're going to get into on how we do that process. But that's originally how I started with Share Ventures.
And how did you get started with Share Ventures?
I had spent time as an entrepreneur founding companies and being inside of venture capital firms, and I wanted to do something crazy and different. I wanted to think about how to use technology in the company creation process itself. And I wanted to focus in on this area called human performance, which really no one knows what it is, but I kind of describe it as a combination of longevity and the future of work and technologies that help us live better or work better as humans. And so that just got me excited about doing something brand new. I raised some capital from some folks that I've been working with for a long time. And then we ultimately raised a fund, and we'll tell you more about that.
Awesome. Well, I see some products here on the table. Why don't you give us a little background on what problem this solves?
Yeah, so Feno is born out of the born out of the fact that oral health is your overall health. And for so long, we've been only taught that, teeth or oral health is about white, straight teeth, right? Or that's what we believe that to be. But actually, the mouth is connected to the rest of the body quite intimately, all the way from your brain, your heart, your lungs, your gut, reproductive system. And so the bacteria that are in your mouth from not brushing your teeth actually travels to the rest of your body, causing conditions like cardiovascular disease, exacerbate diabetes, Alzheimer's, dementia, gut issues, preterm labor, right? And so it's a really big factor in our overall health. And then the problem is that only 30% of people brush their teeth correctly. And this is in the United States. 30%, get it. 3 out of 10 people brush their teeth correctly on a daily basis. I live this, right? I'm there when a tooth problem becomes a life-threatening issue. And I also see that a lot of these issues could be prevented with proper oral hygiene. And so that's where Feno was born. It's really a platform that's on a mission. And that mission is to bring innovation to solve this problem. And so our hallmark product that you see today is our Feno Smart Brush, which the technique is built into the brush. You brush your teeth in 20 seconds. Has a scanner on the device that uses our computer vision model to give you insights into what's going on in your mouth.
How does it work?
Well, the device is actually shaped to your mouth. So the mouthpiece itself is shaped to your mouth. And what that does make sure that the bristles are in contact with your tooth surfaces and your gum line, right? So that's one of the most important things. The other part is that we have camera technology in the device that allows us to get scans and images of your mouth so that we can tell you about what's happening. So we can spot inflammation, broken teeth, lesions on your tongue or in your soft tissue, right? The way we think about, other brands that we're tracking our steps, we're tracking our sleep, we're tracking our diet sometimes, right? But we're not tracking one of the most important things that truly affects our systemic or our overall health.
So back up a little bit and tell me, 30% of people are brushing their teeth right. I mean, 70 people are doing it wrong.
Yes.
So what is it about this process that makes it right? I guess, so tell me, what is it that people are doing wrong?
Sure. I mean, if you knew that there's technique in brushing your teeth, people don't brush for the time, the technique, and we built that basically in here.
And one thing I had to learn personally is when you switch from, let's call it a passive toothbrush to an electric toothbrush, your technique needs to change. You can't just use the same stroking pattern with your passive brush with an electric brush. You'll damage your gums.
Exactly.
Yeah. And going back to your original question, what is the problem we're solving?
Yeah.
47% of Americans have periodontal disease.
What does periodontal disease mean?
Gum disease.
Gum disease.
Yeah.
Thank you.
And
We need
so
a
what
translator.
are the types of gum diseases out there?
Well, it's in degrees of severity, right? But it starts with the way you might think of it as bleeding gums or inflamed gums, right? So to think about that, nearly half of adults in the United States have some form of gum disease. And that gum disease is what starts that poisoning process of our bloodstream, right? So that goes to our brain, our heart, our lungs, and the rest of our organs.
And this is what propelled us to start the company. There was a paper that Harvard published on a study relating oral health to neurodegenerative disease, so Alzheimer's and all sorts of other brain diseases. And for me, as someone that's not an expert in oral health, I had no idea there was a correlation between oral health and brain health and heart health and gut health. And I was like, I'm a pretty smart guy. I read stuff, but I didn't know that. And then we started to dig into what innovation has actually happened in the oral health space. And this is kind of a good example of what, as a venture studio, what we do. We'll look at a big problem and we'll look at what's happened in terms of innovation to solve that problem. And in this particular case, the disparity was tremendous, right? The size and scale of the problem, 47% of the population has periodontal disease. It leads to all sorts of bad things that we all care about. But if you find a toothbrush, it really looks the same as a toothbrush that we had in the 1500s. And we literally have pictures of toothbrush in the 1500s. Guess what it looks like?
A toothbrush?
It looks like a friggin' toothbrush.
Nailed it. This is a softball question, Chris.
So, it was this is how Kenny and I met. And I was like, I need to bring some folks in that have deep oral health expertise and understanding. And Kenny, aside from being an oral surgeon, went to Stanford and grew up around all this innovation. And so we very quickly realized we needed to tackle this problem. And I think, again, it's a problem that is clear and has created a real mission for the entire company, our investors, all our early customers. And that is really to understand that the mouth is potentially the most important gateway to solving overall systemic health issues. And that's a big claim, but that's what we believe.
I come from running a mouth guard company, so I do actually have some context. And it has been informed to me that the mouth is like a gateway to the overall health of the body. It's like a quick snapshot. It's like having an x-ray vision. Let me just look at your gums and I can get a pretty good accuracy of what your health is. And it may not be the causation of that bad health, but it's indicative of your lifestyle. So if you don't brush your teeth, you probably make other bad choices. You probably eat processed foods. You probably don't work out as much. And so, it may not be the cause of the bad health. It's a very clear sign of when someone has bad health hygiene, their overall health is probably lower than the standard as well.
Yeah, it goes both ways, right? So there are things that are correlational, which are kind of what you're talking about. And there are things that are excuse me, like the bacteria, like I said, in gum disease actually releases toxins. Those toxins travel to your brain. They travel to your heart, right? So these are how poor oral hygiene actually result in poor overall health, as well as being indicative of what else is going on in your mouth, right?
Yep.
If you guys are familiar with traditional Chinese medicine, right, the first thing they do is they stick out your tongue, you know, and they see what your nutrition is like, what's going on with the rest of your body, right? Because it gives you so much information.
I mean, people are okay with the word gut microbiome, but in order for it to get gut, it's got to go through your mouth microbiome to get to your gut microbiome. So it's the same biome. You're just getting the orifice that's accessible.
Exactly.
But it's the same system.
The orifice that's accessible.
Sorry.
We're not going to go
There's a lot of potential puns here. But
So I want to know a little bit. I mean, there's so many directions to go. So I would say let's kind of ground this in what you guys are overlapping with the Venture Studio.
Yeah.
How did you guys meet? And then I would say before that, how did the whole idea of a Venture Studio come about?
Yeah, I'll tackle the second question first. There have been venture studios for a while.
And what is that? Could you please define?
A venture studio is a company that creates companies. So our product is other companies. And there are a lot of different terms that people use for the same thing: venture studio, lab, venture foundry, company builder. There are lots of different ones. I think the term of art that has become the most popular is venture studio. But living in LA, saying venture studio, a lot of people say, "Oh, you're making movies?" And no, we're not. But we actually like to refer to ourselves as a lab. But then when we say that, some people think it's just people with pipettes doing stuff like that. So there are different flavors of venture studios. There are some that are more like accelerators that invite companies that are already formed and already working on an idea to come in, and the studio helps to shape along the lines of what an accelerator would do. And that's one end of the spectrum. The other end of the spectrum is one where the internal team is focused on the ideation and is building a team and tech stack and has the entrepreneurial energy to originate. And there are a few of us, and we consider ourselves more in that category.
How many of you are there?
There are hundreds of venture studios.
Oh no, within your team.
Oh, we have 11 people on the share team, which is reasonably small. And what's interesting about the venture studio category is you have a lot of them, but only a smaller amount that have actually raised capital to do this. Because a few of us could just get together and say, hey, let's just start starting companies, and we could call ourselves a venture studio. That doesn't mean we have a fund or a vehicle that we can use to deploy against experiments and company formation, which is what we've done. We formed a holding company, which is backed primarily by venture capital firms and some family offices. And then we have a fund that's backed by Google, Amazon, and several others.
is that a evergreen fund? Does it have a end date?
It's a traditional venture fund.
Okay.
The major difference, I should say, is that a significant percentage of the deals that the fund will invest in will come out of the studio. So the studio represents a proprietary source of deal flow, in a sense, for the fund. Does that make sense?
Yep.
So how does somebody like yourself go and start a venture studio? Like,
You got to be a little crazy.
Yeah.
For me, because I had started a number of companies, I had started 2 companies at the same time before, and I felt like it was valuable. Started a company called MoviePass and a company called BeLife at the same time. I was previously an EIR at a venture firm called True Ventures, and while I was there, I did that, and I got a little mini exposure to the cross training that comes when you're starting multiple companies at the same time. It's very hard. And there's so many ways to criticize that, right? But I do believe that, frankly, in the rest of the world, and even to some extent in the US, it's not uncommon for entrepreneurs to start multiple companies. And there is a value add. It all comes down to the partners that you work with and the nature of the ideas and the timing and. It's kind of like saying, is a startup model a good model or not? Well, it depends.
Yep.
Venture studio model can be great or it can be not so great. But for me, it is aligned with who I am and what I enjoy and where I think my strengths are. I get very excited about tackling big problems with innovation. I get excited about the learning that comes from playing in different categories to some extent. Again, we're focused on human performance, so it's not like we're doing, radically different things in terms of the domain, but there are different companies solving different problems.
What are some of the other companies other than Feno?
Well, some of the companies we have not announced, but some of them that we have announced, one is called Instill. Instill is a B2B company focused on culture in the enterprise and organizational intelligence, and using AI to do a whole lot around organizational intelligence that was impossible prior to being able to structure that kind of data. So that's one example. Another example is a company called Spree, which is pretty small, but we're focusing on longevity and live commerce and video commerce around longevity. And then we have a host of other companies that are in stealth, solving problems in and around this human performance space. I should mention in our first vehicle, a lot of the capital came from colleagues that I've worked with and firms that I work with. I was previously a partner at Upfront Ventures. They're one of our investors in our venture studio. I'd also, as I mentioned, been at True Ventures. The principals at True Ventures were investors in that. So I think what helps in setting one of these frameworks up or one of these structures up is having some experiences with folks that understand the crazy way that we might go about thinking about business, and then thinking about the evolution of how businesses are going to get built. And I think in particular today, with AI being at the forefront of company building and innovation, we're pioneering something we call innovation workflow automation, which is using a lot of tools to actually start companies. And so that's, I think, an important note in this day and age when you're thinking about a studio.
I think what's important about what you said is most people approach hearing a story of a venture studio of like, oh, that sounds like fun. Start a bunch of companies, raise a bunch of money. But the subtext of what you said is if you're going to do that, you have to be ready to do that. And for you, it was not only your network, but your years of experience that primed you for being the person to run a venture studio.
Yeah, I think so. It's a great insight. I think I've learned a lot having started a bunch of companies now, and I just don't like having to relearn the same lessons. And I think it's inevitable that if you're starting a company, you're going to learn some hard lessons every time. And I think you mitigate the need to relearn lessons. Hopefully you mitigate making the same mistakes. And you can also use some tools in one business across multiple businesses.
Do you not think you could do that as a traditional VC?
Well, I think this goes back to the core of what a venture studio model is as compared to a venture capital company. In a venture studio, you really are the founder or co-founder of the business. And in a venture capital business, you're a coach. You're not a player, really. So we like to be player coaches.
On the field.
On the field, right? And I think in this day and age, it's making more and more sense with the amount of tools that we can use now to innovate and build companies. It's more feasible now than it's ever been.
So how did you guys link up?
So we had another entrepreneur in residence who was an interventional radiologist. And we had this project we had codenamed Self-Driving Toothbrush. The idea, you can freaking figure out how to build a self-driving car. Maybe we can solve the fact that 47% of people have periodontal disease using some automation and technology. And he came in one morning and was like, I've got your guy. He's like, you're going to absolutely love him. I didn't play basketball at Stanford, but I'm a basketball nut.
Okay.
And he was
did
like,
some name dropping.
Initially, he was like, "Oh, you're not going to get along just because you love basketball." But he's also a great thinker, and whenever you're talking about doctors and entrepreneurship, sometimes it doesn't go together. But he immediately was like, "I think he's going to be in that rare air, that rare air." And very quickly, I definitely got that sense and reality of Kenny being, in addition to being a very talented technical physician, the instincts that he has around business are exceptional. And so we spent quite a bit of time together looking at this problem, investigating the opportunity for innovation. We were very nervous about hardware. We were considering non-hardware based approaches to this problem. But at the end of the day, we landed on the importance of owning the bathroom And the only way we believe we can do that is by owning the hardware. I talked to a friend of mine who was the CEO of Ring, which is a company that I had previously invested in when I was at Upfront. And I said, Jamie, he was at Amazon at the time. And I said, Jamie, am I crazy to be thinking about doing a hardware company with a co-founder? And he's like, hardware is terrible. You're absolutely
yes, you
crazy.
are crazy.
Yes, you are.
Good.
In
That's
fact,
a good friend
crazy.
right there.
And Jay, just for the audience, when you say that, it's because you're saying that in opposition to software, whereas hardware would include software plus all the complications of it actually having a physical device.
Exactly right. He was saying that hardware is so hard, like you're crazy if you're doing hardware. And this is from a guy who started a hardware company called Ring and sold it for $1 billion.
Yeah, he has emotional intelligence. Like, don't do it, man. It wasn't worth it.
And I saw him through the journey, and it was not an easy journey. He came out on the right end of it. It was not an easy journey. But then I showed him some early renderings, and I told him what it was. I told him we were doing a connected smart toothbrush. And he was like, oh, yeah, you got to do it. This is amazing. You absolutely have to do it, like 100%.
There's a lot of teeth out there.
This is a $10 billion plus opportunity. He was very excited, and he introduced us to some folks at Amazon. And anyway, so we were very careful and intentional about that. Kenny, I don't know if you have any.
No, yeah, I think going back to myself being a physician, right, or a clinician, is like, okay, well, where do you start a business, and how do you start a business, and how do you maintain practice, right? And that was one of the things that attracted me to the venture studio model, right, was to have an infrastructure that we could build this company in with experience from Hamet's side, other team members with experience who maybe had traditional training in business building, whether it be finance, operations, marketing, et cetera. And then being able to kind of like live in that ecosystem to kind of support it, right? Because early ideas, early businesses, especially in hardware, right, are so vulnerable, right? There's so many things that can go wrong, right? Whether it be the idea doesn't work out, you haven't thought about this, or you haven't thought about that. You can't raise the capital. Capital environments are tricky, right? So there's a lot of different things. And what the studio provided was a big a way for me to leverage my like industry knowledge and industry expertise in a way to build the company faster, right? Mm-hmm. And so I think in speed and intentionality is extremely important, and that's what the studio really provided for me as an entrepreneur coming into a venture studio, which some of the listeners may be on that side of the table, like, hey, no, I'm not this. I believe this is for me, but how do I get started, right? And so this model is actually pretty fantastic to help you mitigate your own risk, right? Because maybe you can't go in your garage and go start tinkering around, because you can't afford to do that or whatever the situation might be.
And you said that you were in surgery this morning, so I imagine it enables you to also still balance your practice with being a CEO of a startup. I still operate to maintain my street cred, with the other providers, but the reality is I want to stay close to the problem, right, and the solution. And as Feno gets bigger, and that's the direction we're going, that will need to sunset. But as of right now, I try to stay close to the problem, and I've significantly reduced my operating time as we have raised money. Mm-hmm. And so it's not the primary focus, but it is something that I just maintain relevance in.
Mm. You remember the first thing you said when we were first talking about potentially having you run the company?
I don't remember.
Okay, so for those of you all who don't know, oral surgeons do very well, right? And Kenny was like, I just don't want to be working with my hands. Almost like as if he was like,
you got in the wrong industry,
scrubbing the floor or something like that. And but I think something that really resonated, and I think in general, like we're not, as a studio, as we build our teams, we're not looking to partner with folks that like need a crutch. Kenny could start a company and do exceptionally well without. Everyone needs great people around them, but we're not saying, oh well, we can partner with somebody because they wouldn't be able to do well without us. It's not about that. It's about who is the most exceptional person for the role to be able to drive the leadership, be the face of the company, drive the innovation, aligning with the values that we're starting off with around innovation and building something big. And Kenny fits that bill perfectly. So I just want to say that, yes, we're very proud of the infrastructure that we're building, and we're great partners as well. Sometimes we won't hire a CEO for a company. We'll just build it ourselves. But it really is about coming together. But I think the important part, just going back to the point about working with your hands, something that you had said early on, which really reflected that alignment, was about scaling care, and that being, you know, one of Kenny's missions. Because what we're doing with Feno is not about a toothbrush. It's about creating an entirely new connection between oral health and overall health as a way of providing care in a very scalable way. This essentially is an agentic dentist. Not only are we getting scans on your mouth on a longitudinal basis, but we're also putting that through a pretty robust model that we've built that will give you insights that maybe ultimately humans won't even be able to give you. And that's a really important true north for us, because not everything we're doing as hardware is hard. There are mistakes. There's always things we're fixing. The nice thing so far is our journey has, the people that have come on to Feno early have been excited about being on that mission with us. And I think that's just important to mention.
Yeah, you know, I almost feel there's some parallels to perhaps the stethoscope was a way that we could take one stimulation auditory and listen inside the body. Mm-hmm. And this is another modality of a neo-stethoscope, but you're just looking at a different area of the body, collecting different data points. But functionally, it's the same idea. It's like we want more information that we don't have, and so we need to detect it, sense it in some capacity, and you've built a widget that allows us to do that.
Yeah, and it's important that it's functional and that it provides actionable data, right? Mm-hmm. You can track whatever you want, but if you don't know what to do with it,
not information is held actionable.
Yeah, it's got to be truly actionable data, and that's why we, you know, in general at Share, one of our themes is like we are really ambitious. We are not shy about saying, oh, no, we're going for the $10 billion market, right? Or $10 billion valuation of the company. Like, we're not shy about that, because that's where we truly believe, one, is the biggest impact. That's where the magic happens, right? Like, just that's where the great ideas come. And so by creating a brush, by doing this, just even manufacturing this was years of work,
yeah,
right? But and wouldn't have be able to be done 5 years ago. Like, we actually used AI to build the mouthpiece, right? We went through over 100,000 iterations of this to be able to get one that could fit your mouth, that could fit your mouth, that could fit my mouth, right? So the point, I say that to say that, you know, we really are, you know, challenge ourselves with what does the problem really take to be solved, not just what the easiest fix is, right? Not which is the fastest one. And that's why we choose hardware. That's why we went after the mouth. That's why we were trying to, you know, build more value than anybody can ever think. It's got to, you know, we create no-brainers, right? It's like, no, this has got to be just feel like, I don't know why I don't have this, as opposed to like, I get why you can have it, right? It's got to be why I don't have this.
I learned one fun fact from my mouthguard days. The radius of your teeth has no proportion to how tall you are. And some of the biggest guys had tiny mouths. And you would like, this little guy, this is the big old linebacker, has this little, he's got a little tiny mouthguard in there. So that's fun fact.
Yeah, that is true, especially with orthodontics, right?
Yeah, because like no correlation.
Yeah, exactly.
So how does this, one, is this available?
Yes, it's available on our website at feno.co.
And how much is it?
It's currently sold in a bundle now that will come with this handle, a mouthpiece, 3 months worth of foam. We have a proprietary blend on foam, a free tongue cleaner, and a free trial of our the Feno Plus, which is the scans and the insights. So that all comes in a bundle at $299.
You guys had hosted an Ask Me Anything on our Reddit subcommunity on Entrepreneur. So thank you, first of all, for doing that.
Thank you for having
You guys got a lot of shade. You know, it was definitely a hot button topic. I think that was misguided, and I think...
What was the shade?
I don't know, people, anonymous strangers on the internet just throwing shade, like any shade you could find. They're like, it's too expensive. This is dumb. Why would we need them? This other one exists on Amazon. It's like, okay, guess there's a lot of cars on the road, but there's a difference between like a Honda and a Ferrari and like what you use it for. It's like, it was just, you know, anonymous Reddit. That's Reddit for you know. You don't try to swim up the river. But what I want to help people understand is the healthcare economics of addressing the point of care in oral health, and how if you don't, then you're just going to be paying for these people's long-term reactive care.
Yes.
And this is another form of proactive healthcare delivery targeting the window of the most expensive population. So if you think about dollars and cents, the people who you spend the most money on are a small sliver of our society. And if we can get them to start brushing their damn teeth, it might save a lot of money presenting them from nursing care, long-term ICU, whatever, diabetes treatments,
Right.
GPL-1, that's expensive. It's like,
Yeah.
let's do things. And so while people were focused on the initial hardware price, to me that was chump change. If you don't have someone going to the hospital and billing all these doctor visits, the economy is going to save money.
Right.
And so let's not be so myopic. It's like, I wouldn't spend money on that. It's like, cool, you're not the customer.
Right.
You don't have periodontal disease.
Well-
You're not who I'm selling to.
Well, here's the reality of it is that some of the people who say that, they don't even realize that the amount of money that they spend at the dentist, right?
Yeah.
So even on the individual standpoint, as far as like, hey, a root canal costs you $1,200. I guess
With insurance.
with insurance. It's not
That's
like you just
post-
walk. Yeah, it's like, and by the way, root canals don't happen overnight. It's a slow burn,
Yep.
right?
Yeah.
So you can see these signs ahead of time. You can see these things coming out. One of the most prolific cancers is head and neck cancer, right? That a lot of times will show up on the tongue. It's slow, so meaning that you can cut it out and get it taken care of. Again, but early prevention, you need proactive care to be able to do that. So, I understand what people are talking about, the extremes of whether it be elderly care, children, disabled, and absolutely this is designed for them. But I would challenge those people to think like, well, how much do you spend at the dentist, right?
Yeah.
And what are your brushing habits? Because it's only 30%, right? And there's a small sliver of that are healthcare providers who are probably brushing their teeth correctly. So the general population are really just not brushing, right? And so, it's an interesting comment. It's an interesting perspective, and it just takes some education.
Just to add to that, I think what you said is spot on. We a couple populations, the general populations that have seen a whole mouth toothbrush have seen some very crappy, no shade on folks, but let me say it differently, very inexpensive
Yes.
whole mouth brushes that we've bought all of them.
Mm-hmm.
Before we built this, we bought every single one and tried every single one. I'm not going to go through all the things, but just to give you one example, our bristles are nylon bristles, and obviously we've got a proprietary way of shaping the brush head and all that stuff. People use nylon bristles for most of these, not nylon. They use silicone bristles for most of the whole mouth toothbrush. You ever brush your teeth with silicone bristles?
No.
Take some rubber bands,
Yep.
put them in your mouth, chew them, and then put your cell phone next to your jaw. That's what it feels like.
Nice.
It does not work.
Yep.
So a lot of people are going to say, "Oh, I've tried that." To your point, not all brushes are created equal, and it's very vast.
Very vast.
Yeah.
It's
Very
like, but it
vast.
looks like I understand you make it look like it fits in your mouth. That's not the object here.
Yeah. So it's like they are a perfect U. By the way, no one has a perfect U mouth in the world. So it's not going to work.
Nope.
Right. So I think that's one thing. Another population that we talk to a lot that has a very interesting reaction are dentists. We'll go into a dentist and we'll typically start by showing them a picture, and they'll immediately say, "Oh, I've seen that." Dismissive.
Yep.
"Oh, I've seen that. That doesn't work. It's not going to
novel.
work because of yeah." And we're like, "Okay." And then we say, "Okay, well, we have a way of sizing the brush so we get the proper arch and we get full coverage, and these are nylon bristles and they're angled in such a way that they stimulate the gum line, and and by the way, we have a scanner that allows for you to see gum line recession at the millimeter level, or tongue topography changes or color changes, whatever." And they lean in, they start asking 2 or 3 questions, and I swear 100% of them say, "I want to sell this in the office. I want to be connected. I want to be connected to my patient." Because there's no way today, dentists are entrepreneurs.
Right.
Kenny can tell you.
Yeah.
There's no real credible way aside from saying every 6 months you should come and get a cleaning.
Yeah.
But now if I say, hey, you have a little something going on, we've noticed longitudinally what's changed.
Yep.
Maybe you should come in and get checked out. It's a credible way of connecting and elevating that standard of care. But I just find that crazy that it's so broad. Like someone comes in, immediately their reaction, if we only have 5 seconds, nothing's going to happen. We never only have 5 seconds, thankfully. And I would say almost 100%. I'm trying to think of one that did not say, well, I want to sell this. I want to be involved, because everyone understands how technology is changing everyone's job.
Yep.
And the dentist is no different.
or they feel it, right? I think that's the other thing, is like when they actually hold it in their hands and they realize, oh, okay, and now I see what's happening, right?
Can I see this?
And so the design is
Thank
very
you.
intentional. The shape is very intentional. The way that we approach it is very intentional. It's because we want to provide a better way, right? That's not only that's well thought about, that communicates care, right?
So
that communicates care.
So I take it this flexes.
This flexes. It has
brush.
a level of flexibility, because there's going to be, everybody's got that tooth that's a little bit off to the side, or
But-
you want to make sure you're.
But I mean the
gum.
brushing, like in order for it to brush, or as a person.
Oh,
like,
I'm sorry.
Chris.
No. Yeah. No.
We'll fix that in
I thought
post.
this was a family program.
No, yeah. So there's actually a deliberate movement on there, and I'll turn it on. Let me see
Yeah,
if this one.
please.
Yeah. And I'll turn it on so you can see, and it doesn't just vibrate, right? There's actually, you can see the side to side translational movement there. That allows the nylon bristles to actually sweep across the teeth. So much so that when we were testing this, we got a physicist to measure how much sweep we got, and how much friction we got, so that we can make sure we remove plaque.
Yep.
Right. That's how serious we're taking this. And as a provider, like, hey, look, I can't put my credibility online. Like, I'm taking care of patients, and this is what it means to me. This is what it means to us. The levels of detail that we're going to go through.
And there's cameras inside of this as well.
And in the handle here, right?
So that
So it's a
camera
scanner there.
shoots,
Yep.
shoots the back all the way to the molars. From
So yes, so you actually do it very similar to a selfie, right? And that's what allows us to capture the scan,
got it,
right?
got it.
And there's actually more innovation coming there, which is going to be really exciting. But today, right now, we have a full computer vision model that's about to say, oh, you know what? Hey, Chris, something's going on. You got some inflammation on the lower
Tooth
right.
not looking good, Chris.
We got to do something about that, right? And obviously, some of these interventions you can just do at home, right? And just take care of it, right? Before that becomes a gum surgery, that's $3,000 with insurance.
Well, I think the same thing if you said, hey, what if I told you something could fix your root canal for only $500? Like, that's a great deal. Like, yeah, you just buy it 5 years before your root canal and you start using it every day.
Right.
And that's how it does it. So,
Right.
like, it's perception is really the controllable variant here. And they're thinking this myopic, oh, that's expensive for a toothbrush. Well,
Yeah.
it's not toothbrush.
I
It's
think-
proactive healthcare.
It's a cultural, like, kind of hurdle in order for mass adoption.
Well, I think if you look at the price of the leading brands, I'll call them the leading brands of electric toothbrushes, I encourage everyone to go on their websites and check the prices.
Yep.
You will see
Same.
that they range up to $500.
Yeah.
It's 35-year-old technology.
And by the way, guess what? It is connected, and it'll tell you when you brushed your teeth.
Yay.
That's
I know when I brush my
you
teeth.
brushed your teeth yesterday.
If it ain't at least 2 times a day, we're going to have to talk.
Thank you. It's not.
That's exactly what it'll tell you, right? So for $500, you'll get one that tells you when you brush your teeth.
That's a good example of
That's
data.
awesome.
It's like, cool, data. Got it.
Yeah,
Thanks
exactly.
for the data.
Right. So when we think about price or the perception there, we understand, we're sensitive to it, we're sympathetic to that. We get it.
Mm-hmm.
We understand that this is a premium product, but this is not a toy. This is a health device.
How long does this mouthpiece with the bristles last?
Yeah, so we recommend that it be changed every 3 months. People will hold on to it longer. The biggest thing we want to pay attention to is the fraying of the nylon, right? When the nylon starts to fray, then we don't have effective cleaning. So that's why, and then we also have a buildup of bacterial load. So we want to get that changed every 3 months. And that's the ideal situation. Just like your traditional toothbrush, you want to change it pretty frequently.
Mm-hmm. What do you think is this the source of this initial friction that you guys are getting within the first 5 seconds you were saying of presenting it?
Oh, I think it's the one of the first things we did is, so at Share, we kind of break companies we building down into, we call them work streams, right? So they're like they're components of the business that need to be developed and have to get to a certain stage before that company can be, I guess, on its own, right? Mm-hmm. And so one of them is demand. Right. So when we were looking at demand, one of the things we did was on Amazon, we said, okay, well, let's look at all these. Let's see what some of these devices were selling 30,000 units a month.
Oh my goodness.
2 and 3 stars. We're like, what? Like,
why do
so
people
you have
buying
high demand.
Devices meaning like these other toothbrushes.
Yeah. So you have
electric
high
toothbrushes.
demand and low and low satisfaction,
Yep.
right? And so that is what people are used to, is low satisfaction.
Yeah.
I've seen that before on Amazon. It has 3 stars, right? And so that's really where that initial like friction comes from. Is like, oh, is this the same one of the same things? Oh, I've seen that before. Like, no, you haven't. let me tell you.
Basically a shitty market.
Yeah, and so
Shitty products in the market. I should say.
Exactly.
And it's hard. Anything new is just hard. And frankly, even people that get over that initial hurdle of trying it, it's hard even once you start it. We actually say, and you can look at the data, if you've used it at least 5 times in a row, those first 5 times, it's just awkward because, you know, you've almost programmed yourself. You got grooves in your brain. That's
Muscle memory.
Just brush your teeth the old-fashioned way, which is, by the way, one of the problems, right? If you look at people that we have all these plaque studies and stuff, and you look at people, and there's this woman that brushes her teeth beautifully, except for one spot. She always forgets one of her teeth.
Yeah.
It's just the way her technique is, and that could end up causing problem. That wouldn't happen with our device. But I think the point is, like, the way our brains turn something into a behavior, into a real habit, it takes some time for that habituation to take place. Once it does, once people go 5 times and they fight through the natural inclination when they're tired to use their old brush, it's history. They're hooked.
You're not going back.
They're not going back.
Like once you
Yeah.
do full self-driving, you don't drive manually.
Totally.
Exactly. It's a very analogous.
Yeah.
And to make the point more meta, like we at Share, we think about passive ways to sense. So we're passively collecting data using this device to help the user. We think about all the other places where that can happen on the body as it relates to health. And that becomes one of the frameworks that we use to think about how we start companies.
Yeah, that'd be interesting for you guys to have your app connect to the Apple Watch and find some correlations between health differences, you know, or progresses that you may see with starting to use it.
And
that kind of thing is coming.
as you extrapolate this as a platform, right, to use a buzzword here, platforms can have add-on projects. And so I come from the life sciences. There's a local company called CollectGen, and they use microfluidics to test saliva samples for certain drugs and indications and diseases. And so you can imagine, like, we'll throw in detection for you at your monthly rate, and we'll run your test every 30 days, and we take your camera data. And so as the future starts to grow and personalized medicine starts coming closer and closer to the proprietary user, people aren't going to want generic drugs. They're going to want drugs that match their DNA, that matches their mouth, their disease, their issue.
Right.
And you can see these things starting to come together, and just like, you own the bathroom. It's like, you just brush your teeth. You don't need to do all these extras. You have one platform.
Bingo.
Everything bolted on.
Bingo. Yeah. Spoiler alert. Salivary diagnosis are coming down the pipe.
They're coming down the pipe.
I'm sure. No, it makes sense.
It makes
Because you know what the state of the art is now for that kind of stuff. It's not pleasant.
Yeah, it's not.
It's poop and pee. Just to be clear.
There's other fluids that are less pleasant.
We think that they're
for
more.
sure.
Yeah, we think there's a more elegant way to collect data that is extremely helpful for personalized medicine.
Yep.
Yeah, I've seen,
I have a
seen
lot
some of those tutorials. I haven't done it for the home poop testing kits.
Stool kit.
Yeah. I still have one that I haven't had the guts to use in my bathroom.
The shit bag? No, I'm just kidding. So I just have a deep empathy to you guys' product, since I had a mouth guard company and we tried to make it a smart mouth guard company. Our biggest competitor were not smart mouth guards because they didn't exist. It was the status quo. Mm-hmm. I was like, well, I'm paying $5 for a mouth guard. Why would I spend that for your mouth guard? Like, well, sensors measure your head movement, like your kid getting hit in the head. You probably want to know these, important pieces of data. But it was like, the one I used wasn't comfortable, right? Boil and bite mouth guards. Like, well, these were custom made, and so I can totally appreciate how people they have their thoughts. It's the status quo. This is expensive. And again, that's a perspective. That's a relative statement. And that's the big cultural shift we'll have to overcome, is get people understand you don't do this reactively. This is proactive healthcare, and your oral health is the gateway and extrapolates to the overall profile of your total health.
And I think the thing that we always keep core and a part of every conversation is like, hey, let's not even talk about the device. Let's talk about what we're doing. Let's talk about oral health being your overall health, really being movement mission driven, because we will come out with more things. It will come. But you understanding what Feno stands for, where it comes from, what our drive is, and the value we're trying to deliver, that's something that we believe can get over some initial humps. And maybe it's not today, but it's like, okay, well, when this comes out, then I'm game. Like I'm just waiting for this company to tell me more. Right.
I think what's interesting is when you were saying the bit about how important oral health is to your overall health, like my initial reaction was, get it, I've heard that. But access to making impact in that area is so far from our control that it was, in my head, I like dismissed it as like, I know that, but what am I going to do about it? And then, of course, you have your product. As,
Actually,
as
Chris.
But I think that education is obviously very important to let that. But then that hurdle is like that we have this solution and that getting people to trust that.
Yes.
That solution. So I'm wondering, like, what is it like? What is that dentist pitch from that 5 seconds of no to yes? What is that story? You know, that convinces everybody, and then how are you going to tell that to the world?
Well, on the product itself, it's kind of feature driven. So Hamet touched on a lot of them. The way that we think about our bristles, the length, the positioning, everything about this mouthpiece is designed to be effective, right? Efficacy is number one, right? So that's one thing. So when people, especially dentists, when they see that, okay, now I get it. On top of that, access and awareness. When we talk about the scanning capability, the tracking capability, I see why you're saying, and you're going to be able to tell me about this. I'm going to learn way more about what's happening in my mouth and the rest of my body, and you're going to do that for me. Great, right? So it's really about breaking down our solution and what that solution is addressing that gets people over the hump.
How have you guys evaluated your regulatory freedom and how the FDA is going to regulate this? What kind of marketing claims do you make now? What would you like to make in the future? And will you be teaching the FDA any safety and efficacy of your solution?
Yeah, so we are putting ourselves through more rigor than a toothbrush needs to be. It's to be sold in the United States. And so we try to be proactive. Look, it's still categorized as a toothbrush, so that gives us a lot of freedom to get on the market quickly. But we're doing clinical trials now. Right, we're doing clinical trials with academic institutions that will then be judged and analyzed by peers, right? Especially in the oral health community. And so what you'll see towards the second half of this year, you'll see the data comes out about how efficacious this device is, and that'll be an exciting moment, right? So it'll be about building, these building blocks and being part of that conversation and leading that conversation.
But is there a plan to submit through FDA to get some type of marketing approval that you guys reduce X or increase Y? Or
Yeah, absolutely.
Still on the table, right?
Oh, yeah, absolutely.
Regulatory environment.
Absolutely.
And we're mindful. I mean, again, building a agentic dentist, like we're being careful that the insights, the oral health insights that we give to the patients are just that, insights. They're not diagnostics.
Yeah, that's where you start to get into the regulator.
You start crossing the line around regulator, right? So we're being very mindful of that, but we're training on lots and lots of imagery. You mentioned something about Chinese medicine. There's 3,000 years of research on around Chinese medicine, around the tongue, and understanding what the tongue means for overall health. So that's just one subset of the data set that we're using to train what ultimately will provide agentic dental insights. Again, I got to be careful with what the claim is around that. I want to get back to something, I think a question that you had asked, Chris, around just the convincing. And I think also something that you mentioned around your previous company, timing makes a humongous difference. It's all this gray that's helped me understand that more. But you have a company like Function Health. I don't know if you've seen that one.
No, what is that?
It's Function Health is basically a rebranding, repositioning of your labs. They have a partnership with Quest Diagnostics, and you go in and they then give you a pretty beautiful visualization of your labs. But they're doing blood work. Yeah. They're doing exceptionally well. They just closed on a financing at a $2.5 billion valuation.
Nice.
And I was at the Quest, and I was like, it was half the people in there were getting a function report. And I was like, since when was it cool? Has it been cool to get blood work done? But now it's a topic of conversation with so many people.
Oh, yeah.
So, we say, hey, track your steps, right? I was at True Ventures at the time, and they invested in Fitbit, first money into Fitbit, which led the whole revolution into accelerometers and tracking steps. Aura, you track your sleep. I was at Upfront, tried to get this deal done at Upfront. My partners wouldn't let me at the time. That's gone on to be a great company. So why shouldn't you track your mouth? Especially because it unlocks all these things that are related to your overall health. And then I think another point you made is it's nice to track, but it's really nice to know what the hell to do if you get an insight that you need to take action on. And one of the reasons why we like owning the bathroom is not only are we able to track with a device, but eventually we'll be able to close that loop and intervene. Actually, not eventually. Essentially, right now, we're helping you close a loop by being able to give you a more effective brush. But in our foam, which today is a standard but a very novel formulation, ultimately that may be able to be interventional. Meaning if we detect something that you need, that can help us close the loop and potentially treat it.
Just one question about the status quo. How much toothpaste do you put on a toothbrush? What's like the optimal amount?
You're only supposed to put a pea size.
A pea.
That's what you're supposed to do. People put the
gratuitous amount, right? You're only supposed to put a little bit.
And we use a foam. And the reason we use a foam is because we have a large surface area to cover. We want better distribution. The formulation of our toothpaste does best when it's coated over all the teeth.
More surface area, I would imagine, in a foam than a paste.
And then also cleanliness of the mouthpiece itself. So when you just rinse it off, it all washes away. There's none of that gunk, that leftover paste that's stuck on your toothbrush.
Sorry, Gwyneth Paltrow.
Here's the $1 million question. Do I still have to floss?
You do still
have to floss.
No, yeah. We'll get there. But there are some exciting developments in the foam space that we will hope to be able to challenge that. But that's
one thing at a time.
Yeah,
Chris.
exactly.
Walk before we can run.
Talk about old technology. How long has string been around?
Exactly.
I hate floss. I mean, I'm sure everybody does.
Yeah.
Only 10% of people floss the right way and consistently.
I was converted by my last dental hygienist. I had a bad dentist, French dentist, who taught me that Americans were too obsessed with flossing. And then I didn't go to him, just moved, left him.
Probably
and then
a good idea.
The next hygienist I went to was like, your teeth look awful. And he's like, are you flossing? And then I was like, no. And then I told him the story. He's like, that guy's a fucking liar. And so I've been scarred since. So I'm a religious flosser. But yeah, there's a lack of education and transparency into oral hygiene that I think we all take for granted. This cultural thing that once we're trained at 3-4 years old that we do this every day, at night and in the morning, that's it.
Yeah.
Don't need to worry about it anywhere else in your day. That's that cultural battle, that idea that complacency that is 100% wrong. And I think like Brian Johnson with that documentary and his whole mission really challenges the status quo of we don't have to accept the fact that we're going to die. We don't have to just accept the fact that we don't have insights into our body and just leave it at that and be okay. That challenging it, questioning it is actually the right thing to do, and then taking proactive action into engaging with that information is the right thing to do. So you guys are definitely on this tip, and as you're saying with timing, 100%. As this becomes more, this educational becomes more pervasive with influencers, whoever, people just talking about it, and I see it with like that purple. Have you seen that purple stuff? The whitening teeth stuff. It's becoming more accessible, and then also with the whitening that looks a lot like this.
Right.
As it becomes more of a conversation, you guys will be really well positioned to be like, okay, we're the one stop for all of this, except for flossing.
And I think like
we're coming for flossing.
Okay.
Just don't want to miss that.
Please, I want to support that.
At its core, knowing most of our audience are male 18 to 25-year-old men, I think brushing your teeth is a sign of status, and females and people of the opposite sex or of the same sex tend to be attracted to people who have high levels of status. And so if you want to get more dates, having clean teeth is one of the easiest ways to do it. It's a stepping stone. It helps a tremendous amount. So if it's not the cost saving, it's not the economic versus the personal status of having a clean mouth is like an easy way to get credibility. Because I can tell you when you have poor health hygiene, your credibility lowers no matter how intelligent you are, how good your story is, how good your pitch is. It's classic. Cut your nails, brush your teeth.
It's a very real thing psychologically, even on those who may be challenging or struggling with mental illness or depression, right? It's a win. It's a self-care thing. Yes. It's like, oh, hey, I did something for myself today.
Made my bed, brushed my teeth.
Bam. And now you could do it in 20 seconds as opposed to 2 minutes. Imagine that, right? Like, so that's the other thing. It's like,
wait, this is 20 seconds?
Oh, yeah.
Oh, I didn't know that one. Okay. That's huge.
It's 20 seconds. So
we debate on that because I was like, is that big of a deal?
Yeah.
It turns out that it is a big deal. Like, I don't care if it's
I have an electric. It's 2 minutes.
2 minutes, yeah.
You guys need a 20-second jingle.
Yeah.
Like some melody,
You're done.
like some just famous song. It was like, yeah, I get to the 20-second mark and I'm done.
Right.
Yeah.
I mean, and also like my daughter hates brushing because she's got the quip.
Yeah.
It's 2 minutes or a minute
Yes.
and a half or whatever. She hates it.
Yeah.
And yeah, if she could 20 seconds for
we
all
are,
of us.
we're working on a children's version as well. But I think the 20 people have a way to get into Feno through a variety, whether it be convenience, whether it be status, whether it be health optimization.
Yeah.
The mouth welcomes all of that. And that's, like I said, so like what Hamet said before is like one of my missions is scaling care. And I believe a critical piece of scaling care that I think medicine has sort of gotten away from, or general healthcare has gotten away from, is meeting the patient where they're at.
Yep.
Right? If I can speak to you and talk to you about how to get more dates, and that gets you to brush your teeth, bam, that's what we're going to talk about. If it's about, hey, how to reduce your heart disease or chance of Alzheimer's, bam, that's what we're going to talk about, right?
Yeah.
And I think the mouth is critical because it connects and ties all these things. If you want the mother of your children to have a healthy delivery and not be at risk of preterm labor or low birth weight baby, then hey, bam, let's talk about that and how the mouth contributes. So it's really like all these entry points. It's like care. I think that's a part of the care. It's not just like, oh, you do what I say, take this prescription and do what I say, right? It's like, no, let's talk about what's important to you and why it's important to you.
What angle are you guys focusing most right now on for market adoption?
Yeah, that's a good question. I think we get a lot of inquiries and we try to follow where people are talking. We try to follow the conversation. And so convenience is a big one, right? Especially in this age group of 18 to 25-year-old males. Convenience is a big one. Our time, right? And being effective with your time. We do get a lot of health optimization. People who realize like, shoot, I know my mouth is
It's an easy
connected.
win. Like once you're like plugged in, you're like, oh, no, that makes sense.
Yeah.
One more thing.
But he's actually your listener, right? He drives a Tesla or a Rivian. He's fairly well organized. He probably games a little bit. He's tech forward, and he wants the most technologically advanced toothbrush. He has a smartphone. He has a smart car. He has a smart brush. We're increasingly wanting to make sure that women understand, because we think women are also obviously the ones that spend most of the money.
They're the key opinion leaders on the
they are.
Pathnell product.
And we're making a lot of good headway
Yeah, we are,
now
actually,
with women, but initially it was very much the bro.
The quantified selfers.
I do want to talk about maybe some fringe personas, like the rational consumer we've discussed today. Where I am actually pretty empathetic is the people who can't brush their teeth. There are some individuals who are bedridden. Some people have lost an arm, like they physically don't do this. Perhaps, what we learned in the Army, this is how we support the active warfighters. This becomes basic equipment because out there in the field, you don't have any water, but you got to brush your teeth. So it's like water, we haven't gotten to water, but like maybe this says reduces a bunch of water intake. And so when you're camping and, I really like the application back into healthcare though. So keeping in that world, have you guys invested how this might support reducing healthcare costs when it comes to nursing homes, old folks' homes, veterans at the VA who are homeless? It's like, well, if you're in the homeless shelter, you got to brush your teeth. That's one of our rules.
Right.
Because that reduces you going to the VA, and that's expensive. And so, like, let's help you where you're at. Let's meet you at your point of care. Let's deliver and render proactive healthcare, not reactive healthcare.
Yeah. So one of our pillar studies is a study that's done at a VA.
Nice.
I used to treat VA patients in North Carolina. But it was done at a VA, and it was measuring non-ventilator dependent pneumonia. So pneumonia is basically infection of your lungs. And they were tracking, like, why are these people, they're not on a ventilator, meaning that they're breathing on their own. They're just in the bed in the hospital, and they were getting pneumonia. It kills like over 60% of the people who get it, right? It's tragic.
Wow.
And they did two things to intervene on this. Walked and brushed their teeth. What they were finding is that the bacteria that was building up in their mouth, the gum disease bacteria, they were aspirating it just by breathing, right? So it was traveling into the lungs, then settling in the lungs. They weren't walking, and therefore never got cleared out, and they were getting pneumonia and dying. So all they did was brush their teeth and made them walk, and they reduced the occurrence by like over 90%.
Wow.
Right. So now you're talking about in a hospital system, hospital-related deaths, the cost of how long they're going to stay. You know, if you have pneumonia, how much longer you're going to stay. Yeah. So that's maybe a more extreme version. Then you have all the people who visit the emergency room. There's no dentist at the emergency room. If you haven't been there, if you say, "Oh, I got a toothache," they're like, oh, okay, we're going to admit you want some pain medicine. They might even give you an IV.
$3,000.
Yeah, exactly.
Yeah.
And then you go home with no treatment.
Yeah.
So it's like, so even that. So it trickles down. Like you said, at the care facility, nursing care facility, they don't get their teeth brushed.
Yeah.
Right?
Yeah,
And they're
crazy.
slowly deteriorating. And now you're saying like, wait, this is contributing to my mother, my father, my grandmother, my grandfather, dementia? You got to be kidding me. Right? And you just want to brush your teeth? So, and now we can track.
Now you can
that.
track Nana. Hey, Nana, you're slipping.
Yeah.
No, I'm just kidding.
Yeah. You could track, or the nurse, right? So you could track that, communicate with their provider, make sure that they're getting the care that they need. And so when we talk about the healthcare burden, and when a simple procedure or a simple act of brushing your teeth can dramatically affect that, it's a no-brainer.
One thing that I don't think people appreciate is your teeth are bones, and they're bones that are sticking out of your skull. That's why if you've ever seen someone's human's head, their teeth are still on there because it's a part of your skeleton. Yeah. It's just the exposed part of your skeleton. It's the same DM material as your other bones.
Yeah.
So if you're worried about breaking an arm, a finger, you have all these other precautions. Why don't you care about the things that everyone can see? It's one of your most important assets is like your face.
And think about this, any like micro tear or abrasion in your gums is the same thing as your skin. Right, but it's open, and now you're putting food and bacteria in there. It's basically an open wound. We've seen all the commercials of where people are like using illicit drugs, and they're like rubbing it on their teeth or rubbing it on their gums. Or now we've seen like Zen and snooze, right?
Cutting
for
your
nicotine.
gum.
Yeah, for nicotine. Yep. Like it's a hotbed for absorption.
Yep.
So think about all the ways that you're just delivering, poisoning your bloodstream with things that are from your mouth.
Yeah.
Ooh, man.
yeah, it got heavy, right? Yeah, for sure.
I was just thinking, it's that thing. You just take it for granted. It's like I brush twice a day. I floss. I'm good.
Yeah.
And there's so much more. It's
Right.
such an
So much.
untapped space.
Right.
Yeah,
And we
for
don't want it
health.
to be a burden. That's why we make it easy, right? When we're thinking about
Yeah.
design,
Yeah.
May said earlier,
Sure.
it's about being passive. Like we don't, obviously we talk to a lot of biohackers. For some might consider us biohackers, but we don't need you to go get your blood drawn or dip in the toilet every 6 weeks. And we're not necessarily saying that. We're saying the mouth can be addressed twice a day just by brushing your teeth.
There's going to be
20
some
seconds.
communities who this catches on like fire. Like it'd be like rock climbers or something. Like, I'm up here rock climber building on their Feno brush. Like, cool. Apparently rock climbers love Feno. Who
That seems like some great content, actually.
Right?
We should get some rock climbers
I'm
to
for
brush.
sure there's going to be
brush
some,
on the cliff.
niche community that like everyone has, market penetration in some
Yeah.
very small hobby that this is like the ideal situation.
But it's the awareness. To your point, there's so many of these things that we just don't know. When someone like Kenny breaks it down to you, like, oh my gosh, that
Yeah.
does make sense. Like an open wound that you're feeding with bacteria is probably not a good thing for my overall health. But a lot of us don't think of it. We just think of it as cosmetics.
Yep.
And so to answer, I think you guys asked a question about like our marketing message and our campaign. We have a campaign called Beyond the Smile, which we're just now starting, which is really less about trying to sell phenos and more about building awareness broadly
Right.
for all of the ways that oral health is connected to overall health.
That's great. I see also a big, and you guys are already seeing this or tracking this, is through the dentist. If you get that approval from them, actually, I don't know. I don't know, because like when I go to my dentist and they try to sell me that Invisalign, they bring
Does
up
feel
that
like an
3D
upsell.
scanner.
It is an
I'm
upsell.
like,
Yeah.
bro, chill out.
Yeah.
Yeah.
Maybe it is good. Maybe I do need it. I mean, but yeah, maybe it's. I don't know. I'm just throwing
I
stuff
think
out
I think
there.
in general we're looking to elevate dentistry or oral health just to make sure that people are aware of what's going on and why it's important. And I think like I said, even when we're starting with the original problem, the why is the most important thing.
Yeah.
Right? For whatever company
Right.
you're going to start, the why is probably the most important thing. And if that is not clear, if that is not doesn't evoke some emotion in you, I think that you will have a hard time sticking around when
100%.
this breaks and the first one doesn't work, or you get told no for the 50th time, or or your customer says something bad about you. That will knock you out.
Yeah. So I will address some. I'm not going to name any names, but I had worked with the venture studio previously, like in 2021 to 23, and that was one of the problems, is that the management team, mainly the founder, was so like, I got to be on the court. I got to be playing. He would hire disempowered, or he would disempower the founders. And this one thing I see here is that you're there's nothing separating you from like any normal founder that we talk to or that I come across in my work life. You are genuinely attached to that why and that passion. And that is what, gets you up for the 3 a.m. phone call or whatever problems, of which there are many. So I think that is, from my perspective, from my minor venture studio perspective, you aligning yourself with like impassioned, real kind of driven founders seems like a superpower.
Yeah. My favorite word in the world is alignment. And when it comes to mission, that's the most important thing. And it takes time. It takes time to find alignment of mission, alignment of economics, alignment of aspiration, alignment of ambition. But that's where we try to focus the most.
Yeah.
And I think, it probably speaks to your broader, I'm guessing you have a lot of entrepreneurial followers. I don't think, especially in this day and age, it makes sense to do anything other than what you believe can be a mission, because it's too hard.
Yeah.
There's so much shit that can go wrong.
Yep.
There's so much psychological stuff that happens with every setback. If that mission is not like you really want that mission to be accomplished, then people just tap out.
Yeah.
Yep.
It's so every conversation comes to this. Every conversation comes to
intrinsic motivators.
Yeah.
And if it's money, you're going to leave when things are hard.
Yeah. And like, it's so easy to get that quick dopamine hit of like getting inspired by a conversation like this, where somebody hears about, venture studio, I could open a business and have a bunch of different ones, or I could do like transform dental healthcare. But then like, it's all about that execution. The only thing that's going to drive you through that execution is that intrinsic attachment to something bigger than yourself or money or, like material or external validation.
Yeah, it's a great point. And it actually gets even deeper. I've found it gets to a place of, it's not only about a mission, but it's about a general sense that when you have any mission, you're willing to do whatever it takes to achieve it.
Yeah.
And sometimes people can have a mission and still tap out, but it's just not deep enough, if that makes sense.
Yeah.
It doesn't pull them to draw on that energy, those energy reserves that you need when the market crashes or when something terrible in the industry happens.
Yeah.
A question that I often get asked by founders or even other investors is, when is it time to stop? And I don't know that I have I don't know what the right answer is. I know what I feel deeply in my bones. And the right time to stop, if you believe in your mission, is never.
100%.
Yep.
The secret to success is never giving up.
Never.
And a lot of venture capitalists and others have very different opinions on that, right? It doesn't mean that you keep banging your head against the wall in the same way. You definitely change your angle of attack, so to speak, and you use whatever tools and new tools that can help you attack it. But the answer is never.
Yeah. So I have friends, also clients. We basically, through my work, help grow the startup from seed all the way to IPO. And life as a public company is very different than as a private startup. They crashed and burned, and they did give up. And I asked that question of like, I thought we were never giving up. How did this happen? And he started listing all of the we had like Google Cloud for this much. We had like Dropbox for this much. We had all he was trying to blame the contracts, the software contracts that was too high of overhead to float at any number of staff that they couldn't get out of. And I was like, that sounds like bullshit. And then we keep digging deeper and deeper. And ultimately it was a passion, and it was ultimately a loss of that passion and that motivation once they were a public company, because of how their roles changed so much at that point. Loss of control, loss of vision, ultimately because of all the roadblocks that they were
not
hitting
a startup anymore,
and that fast hyper growth.
So
yes, I would say I guess what I'm doing is building upon that 100%. It is all about that unwillingness to give up no matter what it takes. And at that position, I imagine they would have just had to do a deep dive and reframe, like, okay, what is our new mission now?
Yeah.
Now that we are a different company answering
right.
a different market.
That's right. And, this speaks to another point of the work it takes. And this is why I love the lab or venture studio model, is because you don't instantly come up with a mission. You do work to determine
100%.
that mission and really convince yourself that that's the mission.
Yep.
Because of the work that you've done. It's no different than anything else. It's like it's sports. It comes down to how much work you're willing to put in. And if you're willing to put in the work and the shots and in the weight room and in the diet and all that stuff, great things will happen. And it's very similar in deciding and formulating a mission and then being able to stick to it.
Yeah. Yeah.
Question for you about Share Labs. What you guys focus on human performance.
Yeah.
Personally, what type of human performance things, activities, investments, where are you spending money on? Like, what is your regiment as a person, if you're comfortable sharing some of those routines?
Yeah, everything. I mean, the beauty is, I think we love focusing on this space because you can't slack personally. If
I get it. Right? You can't have bad teeth with your dentist.
Exactly.
You can't be an overweight personal trainer.
Oral health, mental health, auditory health, visual health, understanding some of the interrelations between these things, even understanding, I'd say a big part is now how AI helps us understand more about our bodies or our minds that help unlock, right? Mm-hmm. And so even understanding, like one of the areas that we haven't started a company in, but I'm deeply interested in, and spending a lot of time researching and developing some conviction around just the future of learning. And notice I didn't say education, the future of learning, which I think applies to us throughout our entire lifetime. And understanding the personalized learning that will inevitably come with AI, but then thinking about what are the tools and what are the ways that we potentially get some biomarkers for learnings and things like that. Those are the things I get really excited about, especially as we think about the future. We tend to be techno optimists. Yeah. I'm sure you guys are too, but there are obviously a lot of things to get really nervous about. Yeah. But one of the things I think that kind of related to the last point we were talking about is a sense of purpose. Today, if you look at people and their sense of purpose comes for their jobs. Yeah. Well, guess what? AI is coming for their jobs. Yep.
Yeah. And identity is going to be a big switch.
Identity and sense of purpose, which is tied to health, it's tied to well-being, it can even be seen in genetic expression. So understanding what that means, thinking about that within the mental health category and thinking about loneliness. And as you'll note with what we're doing with Feno, we're not usually taking a direct approach. We're taking an indirect approach. In other words, we didn't build like a pill for neurodegenerative disease. We're building a way to take care of your oral health, which we know is going to help with that. Same thing in those other big problem areas,
root
like
cause
loneliness.
Solutions.
Yeah, you wouldn't build a loneliness pill.
Yeah.
No one would really take it, probably, right? It really.
There's a few pills out there.
I don't know. You might take it every once in a while. Right? Just try it. Experiment with loneliness pills. But I think the opportunity to think about the root cause and to use AI to do that and use all sorts of frontier technologies to solve these problems is really interesting. So to your question, as you can see, I've got all kinds of sensors on. I've got an Oura ring as my wedding ring. My wife doesn't love that.
I can see that.
I've got Apple Watch. I usually wear Whoop, but I usually wear it for sleep. I compare all the data coming from all of it to see how accurate it is. And Whoop does a better job at sleep than some of the others. And so I do that. And then I also regularly take my labs and push them through AI models. To get unique insights that I find to be incredibly helpful. I think effectively that's what Function and some of these others are doing.
Do you have a supplement routine? Do you take things?
Yeah, I got about 50 plus supplements.
Okay. Daytime, nighttime, throughout the day? Yeah, let's talk about this. I like the details, so if you're okay with sharing some of these details.
Some of the names of it, I'm going to pronounce it wrong, but it's phosphophytosterine. I think that's one of my favorite brain supplements.
Okay.
And that's the raw name, or is that the
that's
ingredient?
The active ingredient, and you can buy that separately. If you buy one of these big brands like Alpha Brain, that's
they're
usually
nice to be
like
stacked into me because it gets better absorption when you have some other molecules thrown in there. So
They
come up with a good little concoction for you.
But I'm taking ginkgo, I'm taking CoQ10, I'm taking
L-theanine.
I'm taking L-theanine. Sometimes I'm taking magnesium glycinate.
Nighttime, or you take
3 and 8. 3 and 8 at night.
Okay, yeah, for sleep.
For
Do
sleep.
you stack with the melatonin?
I stay away from melatonin.
Okay, there you
Think
go.
about the ball shrinkage.
Yeah.
That scares me away.
That'll do it.
Yeah. What else? Definitely ashwagandha.
Oh,
Although
nice.
I cycle
Okay.
in and out of
I'm
that.
all
There you
about
go.
that ashwagandha.
That shit
That
I
shit
love it.
changed my life. It changed,
Really?
hopefully
Shout out
changing
to
his
Mike.
life too. I turned
Yeah.
him onto it.
Nice.
I do a ashwagandha, moringa, magnesium citrate,
Okay.
like tea every night.
Oh,
It's
really?
transformed my
Okay.
life.
Do you cycle it?
Uh,
They want you
No,
to cycle
I've been
ashwagandha.
I've been
Like
going
5 days
hard.
on, 2 days off? Is that what you mean by
yeah,
cycle?
or they take 30 days off every once in a
Yeah.
while.
30?
The tolerance
I
breaks?
could be wrong on that. I can't remember exactly the protocol. I tend to cycle off it for a couple of weeks at a time.
Yeah.
Maybe
Just
I
so it's
should.
still-
You got to reduce your
Saves.
salary because your body builds up an immune system and
Yeah.
expects
Well,
it.
I only
probably
do it
just
for like a
use
week
more.
at a time, and then I'm off, and
Oh,
then then I go back on.
There you
But I
go.
love ashwagandha.
Yeah,
Yeah.
it's amazing.
Yeah.
It was a good one.
Yeah.
Because when I got my first labs, I paid a lot of money from this guy who's really good. He does all these labs for special operations and all these communities, but he's very dispassionate. He just tells you the
Is
data.
it functional medicine?
Yeah, well, he's a nutritionist, but he just
Nutritionist,
uses
nice.
blood.
Yep.
And he said, "Do you wake up periodically at night?" And I was like, "Yeah." He's like, "Well, that's because your magnesium is low."
You can see it here.
And I took that, and like it solves the problem.
Oh, yeah.
I don't think he gave me this insight, but for me, it's waking up way too early, like 3 o'clock. Do you know what I mean?
Yeah.
And just starting work
Yeah.
in my mind.
Yeah.
And
Running
I
through
know
the
that.
calendar.
running through the calendar, like to-dos that I didn't do or whatever. And the ashwagandha just smooths that out.
Hell yeah.
It doesn't seem to happen.
Yeah. Another amazing toolkit, amazing addition to my toolkit has been rhodiola rosea.
Okay. I've tried that before.
Yeah.
For weight loss, you're in good shape though. You're
No, I want to gain weight.
lean. Yeah. Creatine.
No, for energy.
Okay.
Yeah.
Okay.
For energy and mental clarity.
Okay.
So I do in the morning. I do rhodiola, True Niagen for
Yes.
the
NAD.
NAD.
Yeah, I take that too.
And Tonkat Ali for testosterone.
Yeah.
There
Okay.
you
Okay.
go.
I took some of that. I didn't really notice.
It took. I
Okay.
stuck with it for. I've
Okay.
been doing it for not very long, probably about 3 months now.
Okay.
The first month was nothing.
Then you were an animal in month 1, month 2.
Yeah.
Do you take any
basically.
peptides? You got into that game
BPC
yet?
157 every once in a
157,
while.
nice. Okay.
I messed up my knee a long time ago, so I
So you
used to
take it,
inject
yep.
it in my knee.
I'm on that right now.
Are you?
I had dislocated my shoulder in a judo tournament. So
Oh, wow,
taking a
okay.
few regiments of
Directly inject it?
I put it in my belly, but it's my shoulder
Okay.
injury, so that's
Okay.
where they told me to put it.
Yeah.
So
Yeah.
I get it.
There's just so much. There's so much of culture shifting in this direction.
Yeah.
You know, that of this conversation.
You have to
we're
be your
having.
own health
Obviously-
advocate.
Obviously, we're in LA.
That's it.
It's the epicenter of like the wellness movement.
Yeah.
But I mean, I see it on Reddit. Just see the conversations growing and on TikTok too, especially.
You're gonna get a
It's
mouthful for all these mispronunciations on Reddit. Like actually,
But
It's not rodeo, it's rhodiola.
yeah, sorry. But you guys are primed to kind of fit into this general movement of people taking proactive steps in their
Yeah.
health.
Well, you know, at the studio, I mentioned we have a lot of technical infrastructure that we've built to support our understanding of trends and then automate as much of the workflow process or the innovation process as we can. We have these scrapers that are going through Reddits and TikTok and Google Trends and all these other things. And this category continues just to explode.
Yeah.
I mean, the technical statistic is like 18.5% CAGR in the whole biohacker
Yeah.
realm, right? And it is fueled by exactly what you were speaking to, which is the healthcare system is broken, but people are like, look, no one's coming.
Yeah.
I got to come.
you got to be your own agent.
Yes.
Yeah, I got to figure it out. One of our colleagues says, you got to be the CEO of your own health.
Yeah.
Yeah.
And so, that's why tools like what we're building with Feno are important. People start to build awareness around the oral health and realize it's a way to get insight onto the overall health. It's just part of that regimen.
Yeah.
So, given everything we discussed today, I'd like to enter our closing ceremonies and offer you our last question that we provide to our guest. If you were a 21-year-old today, what advice would you give yourself in 2025? You got to think back. Where were you that young buck?
If
Where were
I
you
was
at life?
21, what
Yeah,
advice?
you meet your 21-year-old today in 2025. So 2025-year-old, 21-year-old.
Okay.
Right? Today, TikTok, social, like different
Yeah. I mean, I would go all in on AI.
world. All in on AI. All right, I like it.
I think
Skip surgery school.
No.
Skip dentistry. No, I'm
No,
just
I-
kidding.
what I-
couldn't
what I-
spell AI when I was 21.
Yeah. What I think is, I think what is often underappreciated is diverse experiences, and so I think having the ability to do clinical and then bounce into tech and then bounce into marketing, like that, I think has just formed such a great perspective for me that I can just say I'm like truly fulfilled, like to have all that perspective and to be learning. And so I think it's just staying curious would be a huge piece, and like, hey, learn from everything that you're doing and try different things. I think that would be a big thing for me.
Yeah, for me, I felt like when I was 21, I was fairly aggressive. And maybe it was just because of my, peer group at the time. But I think I would tell myself, be more aggressive.
Nice.
And,
What were you doing at 21?
At 21, I had just graduated. I was working in a small investment banking firm where I sort of got my first exposure to venture capital financings. We were working on deals for private companies raising capital from private equity and venture capital firms. And so, I was thinking maybe I should start a company at that age, which I ultimately did. A venture-backed company.
Was that Movie Pass with Stacy?
No. I thank you for that. I'm much older than that. So when I was 21, this was before, let's see, how old was I now? I'm 53 now.
Oh, you look great.
So thank you. It's all those peptides.
It's all those peptides. BBC 157, shout out.
Exactly. So yeah, I had exposure to early venture capital, which was really great at a young age. Some mentors that were venture investors, but I was working in investment banking, work with entrepreneurs. It was not until 2000, and it was not until the year 2000 that I started my first venture-backed company. And that was after doing a stint in venture and then in an Africa-focused venture capital firm. So I was being somewhat aggressive, but I would have coached myself to be even more entrepreneurially entrepreneurially aggressive.
Yep.
When I was in college, I started a company, and at that time, no one was starting companies while they were in college. So I thought I was an anomaly already, but I would have probably fanned that. I would go back and fan that even more.
Double down.
Yeah, because I almost felt like, I started a company. It was cute, blah, 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 blah. But like, it was kind of like not as serious. And I would say, no, make this your career now, right? Don't worry about, I probably would have still done the venture capital and investment banking thing, but like, no, start a company now that you think you can get to $50 million, $100 million in revenue. Which at the time, I couldn't almost imagine that someone that young could do that.
Yeah.
You would need someone like you to tell you that.
Yeah,
Like,
I need someone like, no. There are folks that are 21 years old now that are getting after it, about to start their company.
Yeah.
And in 15 years, it's going to be $1 billion company.
Yeah, that 4-minute mile. That the once it's done, the bar just raises, and now I heard it's about the first trillionaire now, not because the billionaire is old news.
Yeah.
Which
Or the
is-
first one person
billionaire
billion-dollar
company.
company.
Yeah, that'll be nice.
Yeah.
Solo founder exit.
Yeah,
Well-
I want to touch on one thing real quick before we close. I think tying it back to this like purpose story, you clearly have kind of one track kind of growth like mindset that I think you're referencing with your double down statement of 21. Like you clearly know what you want to do, and you knew then, and that's why you're saying like do that. I think that a lot of people struggle with understanding what that thing is, what that passion, that burning desire is within them. And so I'd ask you, having met all these entrepreneurs, you interviewing ones, to work with, what is that common thread? What do you think like it gives people like Dr. Kenny here, who knows like that's my vision, my passion? You know, what is it that you could give to people who may not know what their passion or their direction is to help find it?
That is a great question. And there's a part of me that thinks it's just intrinsic. Either you are sort of, that's how you're wired, where you just need someone to encourage that. And there's another part of me that thinks everyone has that. It just might be a little deeper. It needs a little bit more fuel or fanning to actually, it's a small little spark that will ultimately turn into a fire. I think that's probably where I would go. Some people already have a little flame. They just need a little fan, a little bit more fuel. Some people it's really deep down in there. And I think that spark or that, what is that? What do you call it when there's a little ember? That's the word I was looking for. The ember is creativity. Yep. It's like taking something that is in your mind and having it become real. And some people, it's so deep. Everyone has it. Yep. It just might be so deep they're not aware of it. But when it starts to that ember starts to grow, then they start to see it. And then what happens most of the time, someone pours water on it.
Yeah. Sometimes with your closest family members, like misting your ember all the time.
Absolutely.
Like, cool down, man. It's starting to burn up over here.
That's a really important point. That's a really important point because it's not the enemy that oftentimes is the one that puts that out, because you can defend yourself.
Your mom who wants grandkids. Like, you need to start out once you get married.
It's your most loved ones, right? So I think it's about finding that understanding that creative ember, how to fan it, and then when if you're lucky enough that it's already waving, then a big part of it is about navigating fear that we all have. Yeah. That I don't deserve this, or I don't know, it's too risky. Someone could come and step on my fire, and I just think it's about either enabling that confidence or protecting that confidence a little bit. And even as we are thinking about new companies and ideating, we're careful on when we tell certain people, even people that we love and trust, about a particular kernel, about a particular idea or a problem we want to solve, because it needs to be protected until it's burning brightly enough.
Or match will go out.
Then you invite criticism. Then you say, try to put this fire out. I dare you. I really dare you, because this thing is burning bright. But if it's just starting, it needs to have time to grow. And you can talk to people that are going to fan it, that you know and trust are going to fan it so that it gets brighter.
Yep. I love that. We
great.
got to close on that. That was some true wisdom.
Part of our closing ceremonies are a kind of a final lesson on the difference between perception and reality. So the perception is this gift is invaluable because we are going to gift this to you both. The reality is $2.50. So it is not very valuable, but the perception is it's extremely valuable to you, gentlemen. You are now both professional podcasters because you've been paid to be here. Okay. That's part of the perception you can walk away with. Feel free to update your LinkedIn. Yeah. Thank you so much for joining us. We appreciate you. Welcome to our studio and being a part of this collective.
Thank you. Thanks for having us.
Thank you, guys.
Cheers.